When diet and exercise aren't enough, there are innovative and effective treatments to give you the look you want, and fall is the perfect time to take advantage of Precise Beauty by Dr. Jack Zamora. Dr. Jack Zamora and Dr. Jude James Kirk join us today to discuss the variety of body sculpting services offered at Jack Zamora Cosmetic Surgery and Aesthetics. I always love having you on, Dr. Zamora.
Good to see you.
We're talking about the different ways you can contour the body. It's not a one-size-fits-all, right?
Right. And so really to do a great job, you need to have as many instruments available to get the patients to the point they want to reach.
Right. Okay, so we're talking about SculpSure today. This is the buzzword everywhere because it's short, it's effective. Tell me how this works.
Basically, it works by applying these transducers, these connecting pieces onto the skin, and laser energy, light energy is used to melt the fat. And then your body just disposes of it.
Yeah. You know, this girl already looks good, so it's really meant to just kind of slim down those areas where you need a little something, right?
Right. It's going to reduce you about 30%, and so if you have a lot more, we're not going to offer this to you. We need to offer a different type of treatment. Either liposculpture or hormone replacement therapy, or both.
Yeah,
so
and we're going to talk about that in just a minute. You guys have all these different options, and I love that you tell people, hey, this might not be for you, there's another alternative.
Absolutely. And for certain patients that are on the fence, go ahead and try the SculpSure. We'll always apply that towards lipo if it's not as successful as we want it to be. But for the patients who've had it, a significant number have noticed incredible results.
Right. So tell us about what we're looking at. What does the technology do?
Basically, you can see here the light is being applied to the fat, and the fat is specifically absorbing that light energy, heating up, and by heating up, it really kills the fat cells right there permanently. Now, I wish we could turn it up and melt all of it, but we can't. So we can only melt about a third of it safely.
Nice.
But that's enough to see a significant reduction. And so here you see a representation of what that reduction would look like.
Yeah.
We can target certain areas. The most common ones are in the abdomen and the waist. We can do legs. We've done chin, but there are better treatments. This fat young individual...
this is you.
Yes, it was me.
You're not fat at all.
Well, you know, I had a different treatment done on my left-hand picture right there with a different device, and it didn't work, but my right-hand side is after SculpSure.
Really?
And it made a nice difference. And I still have a little bit around my belly button. I just had a second treatment done to hopefully get that last bit out.
Wow.
And yeah, it worked very nicely.
So you're saying on the before picture, you had already had another treatment done that didn't quite get the results you wanted.
I had cool sculpting done on my left-hand side.
Okay.
Yeah, so it's more effective without the issues that come about with certain other technologies, and it worked for me. So.
Okay, we want to see pictures after your second treatment.
Okay.
Because you're already looking pretty hot. Looks really good. I always embarrass him. Okay, so we saw the results of that, and we're talking about, you know, certain areas bringing those pockets down. But you have another alternative just in case you have a little more volume that you want to get rid of, and Dr. Kirk's going to explain that.
Yes. So we use Vaser liposuction, which is an office procedure, affordable, and removes the fat completely and permanently from the body.
Okay, so Vaser lipo, I'm sorry, thank you. So tell me how it works.
So Vaser lipo uses ultrasound technology to liquefy the fat. Once it's been liquefied, it can then be gently suctioned out of the body for a smooth, sculptured look.
Wow. Okay, so how is this different from traditional lipo?
Traditional liposuction is generally done in the hospital or surgical center under general anesthesia. They use a powerful suction device then to remove the fat, which causes more blood loss, more bruising, swelling, and soreness. Vaser liposuction is an office procedure under local anesthesia, which is a lot less expensive. We Vaser the fat layer, which liquefies it, and then we gently suction it out to give it the smooth appearance. That causes less swelling, less bruising, and less soreness after the procedure.
So we're looking at the areas that you can treat. Why don't you go down the list?
So this is shows the abdomen, which is the most common area we treat, and the before and after pictures that I have done in the office. We treat all the troubled areas the abdomen, the love handles, the saddlebags, the inner thighs, back of the arms, the man boobs.
He said it, man boobs.
They
because we
exist.
are seeing women and men in these before and after pictures. And recovery, what's the recovery like?
So there will be swelling for 2 weeks after the procedure.
Okay.
That swelling will then go down over the next 2 to 4 weeks. And most people are back to full activity, strenuous activity within 2 weeks.
Yeah.
That's great.
Well, I think most of our patients, if they have it on Friday, they're usually back to work on either Monday or Tuesday.
Right, but not doing anything too strenuous for a couple weeks, right?
Shouldn't be doing anything strenuous at work, I don't think. So.
No
Otherwise,
way.
it's just work.
Right. Oh, you're funny, Dr. Zamora.
Thanks.
Okay, real quick, you guys also address hormonal issues, which are such a big thing with women.
And men.
And men too,
Yeah.
really?
Yeah, absolutely.
You guys have that problem too?
Apparently. Supposedly.
So, in a consult, you guys can address that and see what the solutions are?
As we approach middle age, a lot of us have more trouble with our weight. We have less energy, become more moody.
Oh, geez, I know about that one. Are you insinuating?
No,
Dr. Zamora, thanks. No,
So
it's true.
we measure the hormone levels more exactly than most medical offices do.
Okay.
We use bioidentical hormones, which are the exact same hormone which you find in the human body.
Okay.
These are safe to use. There's no synthetic hormones, so there's no increased risk of heart disease or cancer.
Okay.
We then optimize those levels so that people have their peak performance.